Hello viewers, I am going to talk about paracetamol poisoning. Paracetamol is also called acetaminophen, and first I'll give you a scenario, then I'll talk about its clinical features, its diagnosis, and then treatment and complications if it is not treated. Now, first of all, the scenario which will come in exam is a 35-year-old man presents in emergency after the ingestion of a full bottle of acetaminophen, 500 mg each, and he complains of vomiting and pain in the right hypochondrium and has elevated bilirubin, AST, and prothombin time. First, I'll talk about its clinical features. Its clinical features are divided into 3 stages. Stage 1 is, first we have stage 1. In most of the time it is asymptomatic, and it lasts for 12 to 24 hours, and then it includes nausea, vomiting, and gastritis. And then we have stage 2, which includes, it lasts for 24 to 48 hours, and it includes damage to liver and elevation of AST, ALT, and bilirubin, and it causes basically the paracetamol causes the hepatic necrosis. Then we have stage 3. In stage 3, it lasts for 3 to 5 days, and it causes the patient feels confused, and there is stupor, encephalopathy also develops in stage 3. Then if we talk about its diagnosis, there is history of intake of large amount of paracetamol, and we'll do the drug levels, and then we'll perform the nomogram. Nomogram is actually a graph which relates the drug level with the time. Then we'll do the LFTs, which include AST, ALT, and bilirubin, and elevated AST is far more greater than elevated ALT. Then prothombin time is also elevated, and bilirubin is also elevated in more advanced stage. And then we talk about its treatment. Its treatment is not that difficult if the patient comes in earlier stage. First we'll do the gastric lavage. In gastric lavage, it is efficacious if the patient comes within 5 hours of poisoning, and then we'll do the give the patient activated charcoal. Activated charcoal is efficacious if the patient comes in 8 hours, and the specific antidote for paracetamol poisoning is acetylcystine. Acetylcystine is, and if acetylcystine is not available, we can use another antidote, which is methionine, and one of the major side effect of acetylcystine is histamine-like reactions, and which include anaphylactoid reactions, Um, um, Anaphylactic reactions include bronchospasm, urticaria, and bronchospasm, and the allergic reactions. And it is reversible if we temporarily discontinue acetylcystine and we give the patient antihistamines. And last of all, if the patient develops severe liver necrosis and a large amount of liver is damaged, we will treat the paracetamol toxicity with the liver transplant, which is the last option. And the last of all is complications of paracetamol poisoning if it is not treated at time. The death basically occurs due to liver necrosis. And occasionally there is renal failure, and which is not that important. Most of important is hepatotoxicity, which is caused by paracetamol poisoning. Thanks a lot for watching this video. If you like this video, please subscribe my channel. Thank you.